turn your head as far as you can to the left, please. Good. And now from this position, I want you to just relax. Drop that head. Okay, let me hold you.
Whoa!
There you go.
Oh my God.
Hi, Santina.
Hi, Adam.
Thanks for coming in today.
Thank you for having me.
Santina is a genuinely new patient coming in for chiro today. She's never seen one before. She's never been treated. Well, she's probably seen chiropractors before, but she's never been treated by one before. All right, so it's a really exciting opportunity for me to kind of show her my version of it. As anybody would be aware who watches my channel, there's a lot of variety in the chiropractic profession. You can click that video up there to kind of get some clarification on that. But I'm really excited today to be working with her, and I hope that she's excited as I am. And she's been super giggly off camera, so I can tell she's nervous, but I'm thankful for her for really stepping out of her comfort zone here. So Santina,
Yes.
Why don't you tell us a little bit about why you're coming in today, like what your physical complaints are?
Absolutely. I think the first thing and the most important thing is because I work from home, there's a lot of stress and tension around my shoulders.
Okay.
Spend a lot of time online, on the computer, on social media, so I'm naturally kind of hunched over all day, so I can feel like at the end of the day, my back or my neck, it's just getting a lot of tension, a lot of stress. And then the other thing is my thumb. So when I craft, I notice that my right thumb in particular swells up a ton, really hurts.
Okay.
And yeah, the only thing that's really releasing it is some massage, but it flares up every single time.
Okay. Now, crafting. What do you mean crafting?
So I make stickers.
Make stickers.
Are we plugging the stickers?
Yeah, we can,
we can plug the stickers.
I'll put the link in the description below, but go ahead. Why don't you tell us about the stickers?
So I make stickers, and because I start the process, like, I'm going to restart.
Oh, no, by all means. Like, we're just rolling here. You don't need to be nervous. Yeah.
So I love talking about my stickers.
Yeah.
But essentially, from start to finish, I do the whole process and production part of it. So from designing, I'm spending a lot of time drawing as well digitally. So already my thumb is getting a little bit of stress. And then when I start to actually physically make the stickers, I'm printing them out, I'm putting on laminate sheet, and I'm really kind of using my hands to manipulate the stickers in a way so that they're going to turn out really well. So by the end of it, I can feel my thumb is starting to swell up and get really sore. But yeah, the stickers, as fun as they are to create, I always end up with a thumb injury afterwards, which is also not super great or sustainable.
I can understand that, like, especially in chiros, like if we start to get bad thumbs or bad wrists, like game over, right? So for you, for somebody who's making stickers all day, I can see how that'd be irritating. Now you also mentioned that you're getting a lot of upper back stiffness. I know you talked about obviously your sticker business, but what I know that you work two businesses. What's the other one? Tell us about that.
So the other one is a creative agency. So I work as a social media marketing manager, as well as providing creative services to small business owners, medium-sized business owners, and professionals. So I spend a lot of time online, on the internet, on my computer, very focused as well, because I'm doing either designing or I'm looking at analytics. So it's a lot of screen time and not so much body awareness when it comes to my posture, things like that.
All right. So we talked about your sticker business. We talked about your creative agency with your social media work, which I don't know. I might probably need her help if any of you follow me on Instagram and Facebook. I'm doing the best I can as a one-man show. But just curious, and this question is kind of completely unrelated to your physical condition. What's kind of the most rewarding thing about your industry, either the stickers or the social media? What do you like the most about that, the gratification you get?
Yeah, absolutely. I think it has to be working with incredible business owners and entrepreneurs. I've been fortunate to work with some very creative, very intellectual people, and to be able to take their ideas and present them in a way that's creative, engaging, and that best represents their brand. And then for them to see it and like that reaction, it's so rewarding and so fulfilling. And then to be able to then translate that into their online community, it's really rewarding. And I get to work with many different kinds of business owners in different niches as well. So I get to learn a lot as well, and to kind of see the creative spin that I have on maybe more science-based businesses. It's really cool and it's really rewarding.
It's pretty obvious to me, at least, that this is something you're really excited about.
Clearly,
into it. So it's nice. It's always fun working with passionate people, right? Like you can really tell if they enjoy what they do, and you can vibe off that energy.
Yeah.
So, all right, back to kind of the condition at hand here. So what we're going to be doing today, all right, you've described some upper back stiffness as well as some forearm complaint with the thumb there.
Yeah.
I'll be doing a physical examination with you, try to figure out exactly what's going on, give you a diagnosis for that, as well as prescribe a treatment plan, okay? And treat you today. So I have strong suspicion we'll have you walking out of here feeling a lot better
Awesome.
regarding those things as compared to when you came in, okay?
Cool. Thank you.
Perfect. To start, I'm going to ask that you bring your chin down to your chest for me, okay? Now, while we're doing this, if you feel any kind of stiffness or pulling in the back of the neck or the upper back, I just want you to let me know, okay?
Yeah.
So as far down towards your chest as you can. Anything in the back region around here? Anything at all?
Sorry.
Yeah, that's you.
Not,
That's okay?
not really. A little bit.
Okay, that's
a
fine.
little bit. It feels like tense.
Tense.
It doesn't hurt, but it's it's tight.
Okay, now if I go ahead and actually push a little bit further, better, worse, or the same?
Ooh, it actually feels nice.
Feels nice.
Yeah.
Okay. I'll get you to come back up and I'll get you to look up towards the ceiling, please.
Okay.
Good. How's that? Anything here?
No.
No? Okay. I'm going to bring you a little further. A lot further, actually. Anything there now?
No.
No? Good. Okay. Face forward. I want you to tilt this ear down to the shoulder for me. Good. Anything there?
Just a little bit of tightness.
A little bit of tightness. Where? Left side or right side?
Here.
Left side. Okay.
Yeah.
Into the... Got
Yeah.
it. Mm-hmm. And better, worse than say, you
little
don't like
worse.
that. You don't like that at all. Okay. Let's get you to... What happened there?
It felt like it was just pulling. It was
Sure.
tense and it was...
Got it.
Yeah.
Okay. Now you get you to tilt your ear to this side. Are you getting similar symptoms on this side?
Yeah.
Okay. And again, when I do overpressure,
Oh, yeah. I
say,
don't like that.
okay, you don't like that at all.
No.
Okay. So Santina's got some really tight scalene muscles. The scalene muscles attach from the sides of our C-spine neck down into our first and second rib structures. So that's what she's feeling there with the pull. I'll get you to rotate your head this way for me. Good, good. So she's getting to about maybe 80 degrees on this side just by herself. Let's do a little bit more. She can get to a full 90. Any discomfort with that?
No.
No? Okay, now let's get you to rotate the other way. She can get to about 85 on this side, a little bit more. Rotate, rotate, rotate. Any discomfort with that?
No.
No? Okay, awesome. Good stuff. Good, good.
Cool. Look at that. My neck can move.
Santina, I'm going to get you to bring both your arms up for me, and I want you to keep them there, okay? Because I'm going to fight you here. I'm going to try to push these down. Good. Good. You're going to bring your arms forward now, and I want you to tilt your wrists backward. Tilt your wrists back. Good. We can still see that on camera. That's important. Good. Good. I want you to turn over and curl your wrists in. So strong.
I used to do weight training.
Used to do. What happened?
My business started to grow.
I hate it when that happens. That's
Right?
the worst. I'll get you to curl the fingers now. Okay, good. So, and it was your right thumb that got swollen, right? Yeah. Okay, so this is your left thumb here. Any discomfort, fight me when I do that. That already feels weaker. That hurts. Where are you feeling that?
I'm feeling it here.
Really just local in that region, eh? Anything up into the forearm?
No.
Stays local.
Yeah.
Okay. All right. So Santina's got a little bit of a decreased strength in that thumb as a result of whatever's going on. So it's good to do a neuro exam because this specifically tests motor strength. So it kind of just gives us a thought about what's going on. That was the fingers. And last one, I'll get you to spread your fingers like so. I want you to squeeze, 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 squeeze. Good. Awesome.
Okay.
Oh. Deep-Tendon reflexes. Going to get you to turn just like that. Can we see this on camera? Yeah. Watch closely. There we go. I can see it twitch. Whoa. And then last one. Get you to bring your arm up like so and just drop. Let me hold you. Good. Good. She's not doing that on purpose.
No.
This is deep-tendon reflexes. This is all just automatic, unconscious. There we go. And then drop the arm, drop, drop, drop. Good. All right. So aside from that little bit of weakness in the thumb there, everything is clear for Santina.
Awesome.
Now we're going to get into the palpation component of the physical exam here. So with the T-spine, let's actually just start, and even that's tender.
Did you feel that?
I felt obviously anybody watching can't feel this, but the moment I put even like a 2 out of 10 pressure on Santina, everything fired on. Yeah. Okay, so that's she's either a little bit nervous, which yes, we know that she is, or she's actually that sensitive. Okay, so. Are you're right-handed, yes, Santina?
Yeah.
Okay.
Can you tell?
Yes, sometimes, and also times it's just kind of like, I mean, most people are right-handed, so some people are like, well, how did you know? It's like, well, statistically, but also like people are you're ticklish up there, aren't you? People are usually more not tender, tight on the side of hand dominance. So in this case, like if I literally didn't know and there was a 50-50 chance of it, the only thing I do is I would feel their upper traps here and upper traps here, and I can tell there it's your right side. Okay. But again, that comes from like months or years of feeling and practicing, right? So you okay?
Yeah.
Well, that's kind of a nasty spot there, isn't it?
Yeah.
Okay, and let's check the same spot on the other side. Also kind of nasty. Oh, yeah, also kind of nasty. All right, so Santina's definitely got some trigger points on her back throughout the upper cross kind of region here. So we're looking at tight upper traps, and we're looking at sensitive middle and lower traps. So if you watch the channel, you can probably figure out what does that mean. We got to relax these guys, we got to strengthen these guys, and we'll walk her through that later. So that's kind of the upper back. Let's go ahead and start looking at the lower back as well. Just to be thorough. Wow.
Whoa.
Okay, so again, if you watch the channel, familiar with this, thoracolumbar junction. Okay, what that means, this is your thoracic spine, your upper back. Okay, this is your lumbar spine, your lower back. Okay, thoracolumbar junction is the point of those two spines meeting. Okay, now upper back is really good at rotating side to side. Lower back is really good at bending forward and bending backward. Okay, two completely opposite direction movements. The TL junction has to absorb all the shearing forces as a result of those two opposite direction movements. Like if you look at the anatomy of your vertebrae in this region, completely different and unique from all the other vertebrae in your spine. But that's also why we end up getting a lot of tension through this region. I couldn't resist that, I'm sorry.
You knew what you were doing.
Oh, exactly. Yes. Okay. So just try to relax as best you can for me, okay? Relax, breathe. Don't forget to breathe. Okay? There you go. Good. You can feel like you're calming down just a little bit, actually.
I think it's, I feel like the right side is has so much more of a reaction than the left.
It is. Mm-hmm. Now, lastly, your SI joint, okay? Bottom of your spine exists your sacrum right here, okay? Your hip bones are known as your ilium bone, or your iliac bones, okay? The SI joint is the connection between the sacrum and the ilium, okay? So, right about here, I'm going to press down to feel it, okay? So, this is your left side, and that's your right side.
Oh.
Okay. Ooh, what do you feel?
Oh, pain.
You don't like the right side, eh?
No, left side's fine.
Left side's fine?
Yeah.
Same amount of pressure, both sides. Santina doesn't like the right side pressure. That corresponds with the tension we're really getting up in the TL side. So, looks like she's actually getting a bit of a lower back issue too, which she wasn't even aware of. But again, as always, a lot of people feel totally fine until somebody comes around, pokes them, and goes, hey, that stiffness is not normal. So it's always good to get these checkouts anyways. Okay. So, I think we're going to start, just because you are in this position, with the thoracic SMT. Okay, now, once again, Santina's never been treated by a chiropractor before. She's never been adjusted before. She's already laughing. She's a little bit nervous. This will be the cracking, yeah. Okay. Very safe procedure. We've already talked about all the consent and whatnot off screen, so she signed that. But just know, very safe procedure, and she is giggling, so it is actually kind of fun. But, all right.
Sorry. Sorry.
Hey, you can swear away. This is a safe space. Okay. I'm good at editing. Don't worry about it. So, here's what it's going to be.
Yeah.
So, I was pressing through like this.
Yeah.
Yes? What I need from you, it's the exact same motion, actually, except instead of being slow like this, it's actually quite fast. Okay? But it's also gentle. So, it's not something you're going to need to really overthink. All I need from you, okay, is to take a big breath in for me and a big breath out.
Holy! That was kind of cool.
How do you feel? How was that?
Whoa! Yeah, that actually felt good.
So, Santina seems to be a fan.
Well, okay, I don't know if I go as far as say fan right now, but I'm not freaking out.
It's still
But you're right, it's quick.
It's a quick little thing. It can be a little bit shocking if you're unexperienced with it, but it's not a massive deal. Okay, and I guarantee when we have you sitting up, you're gonna be feeling a lot better.
Yeah.
So I kind of did this middle region.
Okay.
I'm gonna try to do a little bit down here and a little bit up here. Okay.
Yeah.
So to do a little bit lower down, gonna get you to take a big breath in again, and a big breath out, all the way out, all the way out. Okay, that's fine. I think we might have gotten one little one there.
Okay.
Now let's go up here, big breath in, and all the way out, all the way out.
Oh,
There's another good one. There's another good
Whoa.
one. Awesome. Okay. Now, there was that tender spot here, which actually already feels better.
Yeah.
Still, for completionist's sake, take a big breath in, and all the way out. Let me move your head all the way out. There we go. Okay, so there was one more right there. Good, good. Awesome. Okay. How's this here? That's still tender, right?
Yep.
All right, so again, we're just going to knock out this other side now because you do have another little pain point there.
Mm-hmm.
Take a big breath in for me, and all the way out, all the way out, all the way out. I think we got it on the first one, but just wanted to be sure.
Yeah.
Okay, good, good. So, next, I'm going to probably go after that low back, so I'm going to get you on your side. We got music playing in the background, and Santina's singing along to it. I am in a gym, so sometimes loud music is just pumping. So, okay, so yes, we're in position. We're going to get you to actually bring this leg up.
Yeah.
Okay. And you're in the position there. Good. So all I need from you at this point, actually scoot your hips just a wee bit closer. Perfect. Thank you. And relax. Okay. So from here, let's find that SI joint right there. I want you to take a big breath in for me, and all the way out, all the way out.
Oh, felt that one. Did you feel it?
Oh yeah, no, I felt
you
it.
felt it.
The mic heard it.
Wow.
Yeah. All right, I'm gonna get you to flip over to your other side. Very similar on this side, but it's actually a little bit different because we're targeting different structures. So what I'm gonna do is pull this so that you're a little bit more torqued out.
Yeah.
Good. Exactly. So when we were on your other side, I was targeting that SI joint.
Yeah.
Okay, because I was pressing down on that, we were getting discomfort down the whole side there. Now I'm targeting your lumbar spine itself. So that's why I need to twist you a little bit more.
Yeah.
Okay.
Okay.
So bringing that leg up, scooch the hips towards me, please. Good. And then awesome. So here we go. Big breath in, please. And all the way out, all the way out.
Oh, did you hear that?
No.
Whoa!
Yeah.
Holy! I felt my whole body come out of my body.
Santina's really worked editing skills today.
You are so welcome.
I'm gonna get you to lay flat on your back, okay?
Whoa!
How do you feel? Yeah, how do you feel right now?
Just like I feel like a release.
Good.
Like it just all like it felt like it was exiting my body. I don't even know how to describe it, but that was like kind of magical and terrifying in the same way.
So you heard it from Santina. I'm equal parts magical and terrifying. Okay, that's what every chiropractor
It's a healthy balance.
aspires to be. I love being terrifying and magical. I always wanted to be a wizard when I was a kid, you know. So
But this is kind of the same thing. Wow. Okay.
All right, so Santina, I do understand that you're a little bit nervous about having your neck adjusted.
Yes.
Which is totally fair. A lot of people, if they haven't seen a chiropractor before, can get pretty freaked out by it, okay? But rest assured, I do this 30 times a day.
Yeah.
It's not a big deal, okay? Very safe thing, so. And for those watching my channel, feel free to check out that video up there where I list the reasons why as well as research studies, so. Always plug your own content, right?
Okay, doctor.
Santina would be proud of that one. She is proud of that one.
I am
okay.
proud of that one.
So, Santina, do you get headaches a lot or not really?
Yeah.
Okay.
Yeah, so I get pressure headaches
Okay.
from...
Ooh, fun, yeah.
Oh, yeah. It's because I'm an earth sign.
Santina's super into horoscopes.
No,
that's is that a horoscope? I don't even know.
It's you're also we're Tauruses. You're also an earth sign.
Oh,
yeah.
great.
But I get pressure headaches when it's either stress or when it's like overcast.
Got it. Okay.
Can you tell?
Well, the reason I ask is because at the very top, and this is quite common, at the very top of your neck, this is your suboccipital muscle group here. At any time we have a lot of stiffness or tightness in there, usually that person can also have headaches because hypertonicity of the suboccipital muscle group is associated with something referred to as cervicogenic type headaches. So
Okay.
my guess was that you would have had a cervicogenic type headache, and it's possible that you do and just don't know.
Right.
So anyways,
Yeah.
let's just proceed here. So rest of your neck actually doesn't feel terrible. A little bit there,
I can feel
right
that.
side a little bit lower down, maybe like midway down. But yeah, so let's start off with some myofascial release technique, and that's just a form of massage where I pin the muscles and then stretch them by turning your head. Now this probably is a little bit painful, but also like it hurts so good type deal.
It's a good pain.
Good. You're doing great.
Thank you. I'm trying.
All right. So we're gonna go for it. Okay, we're gonna go for the neck adjustment. You're gonna do fine. Okay.
Okay.
Good. All right. So what I need from you, first
Yeah.
thing, is to turn your head as far as you can to the left, please. Good. And now from this position, I want you to just relax. Drop that head. Okay. Let me hold you.
Whoa!
There you
That,
go.
oh my god. Whoa. That sounded like 50 cracks in one. Whoa. Oh, you felt that.
Yes, I did feel that.
Oh.
And also you did too.
Clearly.
So Santina was actually very relaxed,
Oh,
and
wow.
we wanted to take advantage of that relaxed state before she started to overthink it. So that was
Yeah.
a very good release. Well
Oh,
done.
thank you.
You're welcome.
That was good.
Absolutely. Now it's time to do the other side. So
Okay.
we're just going to do a quick little mic switch here. Go ahead, bring this over.
That was good. Fake me out and.
Yep, that's what I do.
Wow.
I'm in the business of working with stubborn necks.
Whoa.
Okay. So, mic is set. Good stuff. Now, it's just the same deal on this side. Okay. So, we're going to start off with a little bit of myofascial release technique. That's a tight spot,
That
eh?
hurts.
Yeah. I'll back off just a teeny bit. You're doing great. Relax. Breathe,
Yeah.
breathe. Good. It's funny how many patients forget to breathe when they're tensing all up. Like take a breath, relax, stimulate that parasympathetic nervous system. Like, all right. That's a nerd joke.
I went over my head.
That's okay.
Or should I say my neck? Is that funny?
If you have to
Was that good?
now I know how my girlfriend feels. If you have to ask, like, it's not
ask?
funny.
Oh, that was hilarious.
You remind me of me right now. All right, let's bring it back here. We gotta
Okay.
get this. We got serious business.
We have a neck to crack.
Oh, exactly. All right. So same deal. I'm gonna get you
Yeah.
to turn your head as far as you can to the right, please. Okay. Go ahead. Good. That's just right.
Oh.
That's all it is.
Whoa. See, that one felt good too.
Good. So this is just some long axis distraction to help make you taller. This does not make you taller.
Make me grow.
I think Santina's the only patient I've had on the channel thus far that laughs more than I do. Yeah, that's good.
Quality content.
Yeah, it's awesome. Alrighty, then. Good. Okay, good. I will get you to sit up in one moment.
Okay.
Or actually, do you have any comments on that before we actually change the camera and the mic?
That was incredible.
Okay.
That was really cool.
Good experience so far, yes?
So far.
Awesome.
So far, so
Happy to-
good.
I still got time to ruin that.
Oh,
That's
great.
fine. What I'm going to get from you is to just kind of relax for me, all right? And this is to kind of test if, I know before you mentioned that when you massage this region out, thumb calms down, yes?
Yeah.
So when I do something super mean, which is press in here, and bring it like that. What do you feel?
Tense.
Where?
Here.
Really in throughout the whole region.
Yeah.
You're not getting anything down to the thumb. Though,
No.
right? Interesting. Okay. So Santina's still getting the tension down there. Let's go ahead and do this in the opposite direction. So here we were bending the wrist forward. Here we're going to bend the wrist back on the opposite side just to compare. How's that? That's okay.
I don't feel anything.
Perfect. Okay. So Santina's got a little bit of what's probably tendinopathy actually going on of the extensor pollicis brevis longus. It's going to be one of those muscles there. But all of the muscles that connect down into the back aspect of her hands there, they actually all originate up from the elbow here. So the fact that I can pinch here and have pain radiate down here and she's getting symptoms down here makes a lot of sense clinically. So what we're going to do is we're really going to target this region to calm that down, give her some isometric exercise to do to warm up before she does her sticker work, which will hopefully decrease pain. Yeah, sticker work.
To warm up before she makes stickers.
Believe it or not, it can help. It's a movement, okay? We get sore thumbs and wrists too. I have to do my stuff in the morning.
No, I think just...
It's true. Actually,
it's so funny.
now that you're saying it is a funny sentence, but still,
right?
we're gonna
Warm
do it
up
still.
before I make my stickers. Sorry. Before I make your bulk order, let me just warm up my thumb.
Guy. Like
Wait, but that is actually really funny.
I know. I gotta get you to lay down, okay? Lay down.
This is the last time I'm being invited.
Quite late. Okay. That's all it really is.
Okay, that feels nice.
Why do you think so?
Thank you.
So when we're doing this, just so you know, you will get some redness, and it's already actually starting to show up.
Okay.
Totally normal. Not
Yeah.
something to be stressed about.
Okay. This tool looks like those like gua shas.
That's actually what this is.
Oh, is it really?
So, instrument-assisted soft tissue therapy, which is what I'm doing right now. Specifically, Smart Tools, that's the brand that I use. A lot of people refer to it as Graston.
Okay.
Is the only difference between this and gua sha technique is that this is branded and costs money. Okay.
Oh, okay.
Well, like technically, anybody watching this could do this themselves with the back
Yeah.
of a butter knife and a teaspoon of olive oil.
Oh,
Right? Like anybody
DIY.
can do this and get the same, or at least a comparable therapeutic effect. There might be a difference because obviously the average person's anatomy knowledge isn't as great as somebody who
Yeah.
has studied this and like done it.
Right.
But the only difference between this and gua sha is the fact that I paid X amount of dollars to get the tools and get the certificate on the wall over there and everything. I don't
Yeah.
remember how much I paid though. I don't think it was that much. A little tender, eh?
Oh,
There you go. Now
it
it's feeling
really
great.
hurts.
Okay, I'm gonna back off.
That's
just a bit.
okay.
Yeah. Trying to make an omelet here, so.
But I can feel it like releasing in my thumb.
Good. Happy to hear that. That is kind of the point of this whole thing, right?
Yeah. The damn stickers.
Damn stickers, man. It's an intensive activity. You gotta warm up for it. Santina was dying off camera at that, by the way.
Warm up. Let me warm up before I make my stickers.
Yeah, mhm. You're doing very good.
Thank you.
So proud of you.
Oh, thank you
There
so
you go.
much.
Studies show that patients who are given positive affirmations do better in their outcomes, so you're doing great.
Oh my god, I'm like a dog. Sorry.
I did not say that. She said that.
I'm gonna end the bit here.
Oh god. Okay, you're doing fantastic. So hold
Thank
that
you.
there for a
Yeah.
second. And now I'm going to get into the manual work. So
Okay.
I do a lot of what can be referred to as sports massage.
Okay.
And the difference between like traditional just massage and sports massage is that massage feels good.
Right.
Sports massage does not. Okay.
Right.
But the intention behind sports massage is trying to, resolve the problem.
Yeah.
And sometimes you do need to use the same expression again, break
Yeah.
a few eggs to make an omelet, right?
Right. Yeah.
Yeah, so that's the difference between me and a massage therapist, by the way. I'm not here to make you feel good. I'm here to make you feel better.
Okay. See, I love that.
Mm-hmm.
That's great.
You're doing so good.
Thank you.
Yeah. Careful, don't sing. You might flag me for copyright.
Oh, sorry.
That's okay.
Oh, it's a calming technique.
I know.
it's a coping
technique.
coping technique.
Yeah.
Yep. Completely off topic, but when I got my wisdom teeth out, I was singing as I went under the
That's
anesthesia.
perfect.
Oh, that hurt.
When I got my wisdom teeth out, what was it? When I woke up, I wanted to convince everybody that I wasn't high on laughing gas.
That's
so the way that which in itself is a very high on laughing
Yeah.
gas thought.
Yeah.
But my method of doing this was to display my superior coordination by skipping out of the dentist's office. So I literally skipped down the hall, out into the parking lot, around the car, and into the passenger seat.
Oh my gosh.
Just to prove to my mother,
prove
who was
it.
picking me up, that no, I'm not high at all. See, Mom, I skipped out here. That's how you can
Watch
tell
out.
it didn't have any effect on me, you see. And
That's so funny.
it's a funny story now. Yeah. All right. Almost done. Be happy I didn't bust out the acupuncture needles for today.
That's my apple.
That's
the apple.
we established a safe word prior to this, and that's what apple is, just so everybody knows.
Yeah. That would not happen.
Yeah.
Oh. But would you recommend, like, is it another treatment for something like this?
Acupuncture is actually very effective at treating the pain component of tendinopathies, which is actually like 90% of the reason why I got licensed in it.
Yeah.
Because chiropractic, like the traditional adjusting, like pop,
Yeah.
like, really doesn't do that much for tendons.
Right.
Really does not.
Yeah.
So I wanted an additional mechanism aside from just the soft tissue component and
Yeah.
the exercise component to help treat those people who are in the acute stages of it.
Yeah.
Or not really the acute, but the subacute, rather, stages of tendinopathies, and that's typically when I recommend acupuncture the most. That and shoulder complaints, actually.
Interesting.
Because acupuncture is very, very good at restoring lost shoulder range of motion, and TMJ, which is our jaw muscle right there. So, all right, and with that, actually, I think we're good to give you a little bit of a rest here.
Awesome.
What I need from you here, we're going to adjust kind of this joint in here in the thumb where it meets the carpal bones.
Yeah.
I'm going to get you to just lean back and away from me, okay? Like just whole body weight, lean back, lean back, lean back. And just actually, one sec. I'm going to reposition the mic.
Yeah.
On this one.
I'm nervous, you can tell.
That's okay. Lean back. Good.
Oh!
There you go.
That stings a little.
Yeah, you're going to get a little bit of a stinger, but it's going to calm down in a few minutes, okay? There you go.
Whoa! Oh my God. I don't know what I was expecting, but it wasn't that.
Well, that's what it is. Yeah, that's how we adjust thumbs.
Nice.
Yeah, good.
Okay, cool.
All right, so last thing.
Truth thumbs. Sorry.
I'm going to get you to go face down. And it's time for the massage gun. I know you're
Time for
looking
you to
forward
stop
to that.
talking.
Massage gun coming in.
Okay.
Most of my patients like this. Ticklish?
Yeah.
The trick to get around ticklishness is to press a little bit harder. Great job today,
Super
Santina.
relaxed.
Yeah. So as I mentioned to you guys before as well as Santina, when we were feeling up and down her back there, we found a lot of tension in the upper traps, but also a lot of sensitivity as we dropped down lower. I'm finding you should turn around here. As we dropped down lower towards the middle traps as well as the lower traps here. So the solution, as I said earlier, loosen these guys, which we have done, and then also to work on the middle and the lower. So the way we're going to do that is just with some very basic resistance band exercises. So for that, first one I'm going to do for the middle traps is very simple. You're going to just grip it like this. Be sure to keep your shoulders depressed, keep them really low, okay? And you are going to simply spread them apart like that, okay? So I want you to go ahead and do that. I'm not going to have Santina do the, just keep doing it for now. I'm not going to have her do the full necessary reps and sets for the condition on camera. She can do this on her own time. I would recommend probably maybe 3 to 4 sets of 15 every other day for this, okay? Now, the second exercise as well to target the lower traps, that was the middle, we'll take this one. Okay. Very similar in motion. You're going to be holding it in front of you, except with your wrists supinated. That's the fancy term to say up, okay, towards the ceiling.
Supinated.
And you're going to be pulling the band apart, just like that. That really targets the lower traps, so go ahead, Santina. And just like the first one, we're going to make sure that she's doing these 3 to 4 sets, 15 reps every other day. Good, so go ahead. This is a very strong resistance band. I want you to try to keep your elbows a little bit more tucked when you do that. Okay. Okay? But yes, this will be difficult. We'll find one that's more fitting for you, okay? Good. All right. And then the last thing, which is not complicated at all to help out the thumb, is to simply just do some isometrics, which you can use a stress ball for prior to her doing that aggravating movement. So very simple. Go up, show the camera what you're going to do. Very simple. Squeezing as hard as you can, 5 seconds. 1, 2, 3, 4, 5. Relax. Good. You can do that literally indefinitely. There's no way doing it too much, but be sure to do that at least for, I'd say, 5 sets prior to your very intensive sticker making business. Okay?
Yeah.
All right, perfect. There we go. How do you feel after all of that?
So much more relaxed,
Okay.
I have to say. I feel less tense, less kind of stress inside my body, so I feel relaxed, yeah.
Good. Happy to hear that. Now, I know you were saying that you feel like you need a nap, and that's actually not a surprising thing. A lot of people do feel that way afterwards. So, overall, first chiro experience, what did you kind of like the most about it, if I can ask?
Yeah, absolutely. I was terrified, as you know. So what I really appreciated was you kind of educating me each step of the way of like what we're doing, why we're doing it, and then taking a very like gentle approach to it, which helped me, as giggly as I was and still am. It helped kind of calm my nerves in the sense of trusting that obviously you know what you're doing, but to like actually make that translate into the calmness of my body was able to let me adjust.
No, I was very impressed with you because you did seem like you were quite anxious going into it, and of course I want you to be as calm as possible and know like this is a safe space, right? But you did relax very well, and I think we really got quite a good chunk of like input into you, so I'm really happy with that. And that's kind of just a testament to anybody watching. Like again, a lot of variety in this profession. A lot of chiros will not take the time to educate, but a lot of the more modern, younger ones, that's becoming more and more prevalent within our field. So I always recommend to people who are looking for a new chiropractor, consider seeing somebody on the younger side because they have this more patient-centric approach. That is a generalization. I know tons of older established chiros who treat exactly like this, but that's just kind of what I know from my admittedly a little bit biased experience. But I'm glad you really appreciated that because I do try to take the time to make my patients feel like relaxed and heard and all of their things. Otherwise, I hope you'd recommend me to a friend.
Oh, absolutely. Absolutely, I will. Absolutely.
And I'm excited to see you again whenever whenever you need me. So.
When after I do my warm-ups.
Oh, yeah. we'll run you through those for sure.
Perfect. Thank you so much.
Of course, Santina.
That was so good. Okay. Don't forget to like and subscribe and hit that bell notification button so you get notified anytime I upload a video. Or Adam uploads a video, not me.
Santina insisted on that being included. Yeah.